All right. Hello and welcome, everyone. I'm Dr. Tom Chaney, and this is Living Health Live. Joining me on the show, as well as in life and in our practice, Living Health Integrative Medicine, is my wife, Dr. Stephanie Chaney. We are your trusted source for the latest information to help you get and stay healthy naturally. I'm very excited to be joining you and taking you on this adventure of a lifetime, your lifetime of great health. You're going to get some great information, health strategies, and the latest research on how to live a better and healthier life. Just keep in mind the information on the show is intended as educational and informational only. The information given here is designed to help you make better health decisions, not intended as a substitute for medical treatment. So on today's episode, we're going to be discussing gluten sensitivity beyond the basics. And we have a special guest. Dr. Steph, you want to introduce our special guest?
Yep, we are here today with Dr. Sam Sunshine, best name ever, medical director and founder of OC Sports and Wellness, a direct primary care clinic in Orange County, California, Sunshine State, a graduate of USC School of Medicine, completed his residency in family medicine and a sports medicine fellowship at Kaiser Permanente in Southern California. Dr. Sunshine specializes in functional medicine with a strong emphasis on prevention, focusing on the 5 pillars of health: sleep, exercise, nutrition, social engagement, and stress management. He also treats sports injuries using PRP and prolozone injections and offers peptide therapies to support optimal health and performance. Welcome, Dr. Sunshine.
Thank you so much for having me.
So we brought you here today. Gluten is a topic near and dear to our heart. We obviously wrote a book on it. We've been practicing functional medicine as well. And I really look forward to hearing another provider's clinical experience and expertise with regards to how to deal with this. And it's been an interesting, I would imagine you've seen the same thing over the last 15 or 20 years, evolution of the popularity of going gluten-free, or what that means, but there's still a lot of misinformation and confusion and whatnot around the topic of gluten and how to deal with it in a practice setting.
Whether it's celiac disease or non-celiac gluten sensitivity, and you're having your cheat days each week, you're not going to improve. Again, I do think, and I think studies have shown gluten is probably the number one cause of leaky gut.
Yeah. I remember having a patient who was really strict on her gluten-free, keeping the cross reactions out and all that. And then just like Dr. Tom said, I don't know, she was a teacher, they had something at school. She got into a little graham cracker bag of animal crackers or something that had gluten, and she had an intestinal flare-up. And it lasted weeks and weeks. And I think it was so traumatic because she'd always had bowel issues, but it was like she was always in this gluten eating flared up cycle. So her normal was just being sick all the time. And then when you get better and better and the body's healing and you get an exposure and you really react to it, it's more noticeable and you realize how long that can last in some people.
I think so. I think when people go on a hiatus from period, let's say 6 months from gluten, and then those who are reacting to it reintroduce it, they're like, wow, I didn't realize how good I was feeling eliminating gluten now that I've reintroduced it. Boy, all these symptoms are coming back, and they really do notice it. I think they are more sensitive.
Yeah. And then we got to wait it out.
Mm-hmm. Yeah, I don't have a good answer in terms of how long does it take.
It takes as long as it takes, I think.
Yeah, for the immune system to calm down. And what else are they doing to calm down their immune system? Exercise, sleep, supplements.
So now let's talk about a little bit about, I think it was mentioned cross-reactivity. So you mentioned array 4. So that's another panel that Cyrex runs. And so that looks at cross-reactivity. So can you explain what that is?
Yeah, so some protein sequences in these other foods could be similar to gluten or glutenin or gliadin. And so there is some cross-reactivity, not always, but what we have on the education library on cyrexlabs.com are these spec sheets. And so whenever we're going through these results with clinicians, or if you're going through these results with the patient, you always want to look at those spec sheets to identify what other foods can cross-react with that food. And again, it's similar protein sequences. So the antibodies are recognizing these as being foreign and they're going after them. There's that cross-reactivity based on amino acid sequence. So you can look at those spec sheets and give you a good idea of what other food to avoid.
So if someone I had on that panel tested to tapioca, yeah, and that's in a lot of
There's
commercial.
like 6 cross-reactors for tapioca, right?
Yeah.
It's like kiwi, and there's some pathogens that cross-react with tapioca. Yeah. So if you don't have a lot of tapioca flour in your diet, you got to look at these other
These other things. Right?
cross-reactors.
It also keeps you away from a lot of commercially made gluten-free stuff since everything's got tapioca in it. But so in essence, that panel, array 4, is that showing like a gluten antibody reaction? Is that because it's really is that the body reacting to tapioca like it's gluten, or is it just similar enough? Like, what is that really testing?
Yeah. So I guess the reason Dr. Vojdani, who's Risto Vojdani is the chief scientific officer, is he's picking out foods that people at least in that one section, which is the third section on the array 4, is looking at foods that are commonly consumed when you're on a gluten-free diet. So it's the amaranth and teff.
Quinoa.
All right.
Yeah.
And there's quite a few. So they are distinct from gluten. But they can potentially, some of them do cross-react with gliadin. So they have similar amino acid structure to gliadin, but they can cross-react with other foods as well.
Okay. So when someone gets their array 4 back and it's showing an out of range with that panel, like you said, tapioca, there might be 6 other foods that they could likely be having that reaction to, but that specific test result with tapioca being out of range, the lab has tested that for a gluten type reaction, like a gliadin. Am I getting that correct? That's how I've always interpreted it.
It's just a purified tapioca antigen that's mixed with the blood. So it's looking specifically just at tapioca.
Okay.
And
So when that tests for eggs on array 4, how does that differ from the big food panel eggs array?
Yeah, this is a point of disdain with some clinicians because there's nothing on the array 4 that's on the array 10. They don't duplicate anything. So what's frustrating on the array 4, it's just looking at raw egg.
Okay.
And it looks at cooked egg and cooked egg white, cooked egg yolk.
Okay.
And so clinicians are like, why don't they just put the raw and the cooked on the same panel?
Okay.
I didn't develop the test, but I say, yes, I understand, but order the array 10 if you want to look at 80 cooked and raw foods, but it's not going to go into, certainly not any detail on the array 10 looking at, I think there's just one, looks at alpha gliate.
Yeah, it's very basic.
Not the test you want to order for looking at gluten. It's looking at other foods. So I typically recommend starting with the 2, 3X, and 4 with an immunoglobulin panel, because that's going to be the low-hanging fruit. And if the patients test normal for those 3 panels, then I'm looking at what could help, maybe doing a more broad food panel, which is the 10, or looking at chemicals or pathogens.
Right. Yeah.
If people have that constellation of symptoms that we all know all too well, it's multi-system symptomatology, that they're not getting better with a traditional treatment.
I don't think we hardly ever see anyone coming back to complete -3 and 4. Maybe if they're on a corticosteroid or if they're on an immune suppressing, and oftentimes we won't even run that test if they've been on a steroid recently, because we almost expect everything to come back negative, which is an interesting thing in and of itself. Are there other situations where like somebody would really test negative, but it's like a false negative?
Yeah, that's a great question. And so I typically like to run that immunoglobulin panel. We call it the GAM. That looks at total IgG, total IgA, and total IgM. You get it through Quest or LabCorp as well. If you do order with another panel or another array, I think it's $19.99. So I typically will get that if I have a new patient and I'm doing antibody testing, which is the majority of the Cyrex tests is antibody testing or ELISA testing. And so you want to make sure you're dealing with the full complement of immunoglobulins. 1 in 400 people will have an IgA deficiency. And I have a couple of patients that make no IgM at all, but they're totally healthy.
Interesting.
So it's very fascinating. But if you're doing these tests, you're like, wow, everything's less than, especially the IgAs, everything's less than, which you'll sometimes see. You wonder about an IgA deficiency.
So going back to the cross-reactivity, we have patients come in and say, I've cut gluten out and then I didn't feel any better or didn't notice anything. Could that explain that? Like maybe they do have a gluten issue, but they're still consuming reactive foods that are cross-reactive?
Give me an example. I'm not sure I fully understand the question. I'm sorry.
Yeah, I'll give you an example. I have patients that said, I went gluten-free, but they're still consuming corn, buckwheat, quinoa.
They went wheat. They went wheat and gluten-free.
Wheat and gluten-free. Yeah.
Right.
Yeah. And they said they kept the grains in, but just not the gluten-filled grains. But their symptoms did not change at all. So they still have brain fog or gut issues or whatever it is their symptom is.
Yeah. That's a common question is, gosh, if it's not gluten, what else could it be? It could be any other food, or it could be a chemical like a toxicant or a pathogen that could be causing their symptoms. That's why I like the Cyrex testing is you're able to look at these possible triggers. You're really casting a really broad net with a lot of these tests. All right. Looking at either food triggers or chemical triggers or pathogen, these stealth pathogens that can trigger it. So just because you avoid gluten, that may benefit a small percentage of the population, but not everyone's going to say, oh, I feel so much better that it's not going to be the majority of the patients where they avoid gluten and they're going to all of a sudden get symptom relief. Because there could be other things, leaky gut, high stress, poor nutrition, or they're reacting to something else or have some other underlying autoimmune condition.
Yeah, it's interesting because again, going back to tapioca, before I did an array 4 and found out about tapioca, we were trying different gluten-free pastas. Sometimes we're trying things just to be able to consult patients on them. And there was a brand of purely tapioca-based pasta. And it's great because it's like the closest consistency to a noodle. And I bloated like a puffer fish. My gut, it was worse than a typical gluten reaction. And then, of course, we run the array 4 and I realized, I've got the major tapioca problem. No tapioca for me.
Yeah. But it's interesting because people think, okay, I'm just going to start eating more gluten-free. Yeah. But still, those products can be ultra processed and they might have other proteins like you experience that they're reacting to. And again, the general population and even most clinicians just understand the whole food immune reactivity concept. It's not taught in medical school. Maybe it is, and I think it is in naturopathic school. But these are things that people just are not aware of, that we react to things, and our immune system is being exposed to more and more foreign things. So allostatic load, right?
Yeah.
Right.
Now, one would assume that if you practice avoidance of these reactive foods, whether it was the big array 10 or 4 or gluten, whatever, that there's a possibility that after working on your gut and avoiding for a while that you might be able to rotate things in. But you said that if someone's testing out of range, it might be a lifelong thing. I've run array 10 on myself probably 3 or 4 times over the last 8 or plus years. And I consistently still test out of range to foods that I do not eat anymore. Now, I used to eat them all the time. And for me, it's blueberries, asparagus, pineapple, and bananas. Blueberries and bananas, that's your morning shake, right? So I've now don't eat these for 8 years. And I will run array 10 just to see what's happening. And pray that chocolate doesn't come back.
Or red wine.
Yes. The cocoa thing is my big thing. I eat chocolate in some forms every day and thank the chocolate gods I don't ever come back reactive. So that's a food I eat all the time, but I still test really high to blueberries, pineapple, asparagus, and bananas, and I don't eat those at all. So,
Yeah, I would go to the spec sheets in the education library just to see if there are any cross reactors.
okay, so
Because
I might
it
be
could
reacting.
be to another food.
Okay.
And so you can look at that and see. The array 10 is pretty comprehensive. So
Yeah.
it cross reacts with corn or oats or something, but you tested negative for corn and oats on the array 4 or on the array 10, then you're okay to eat it. But just look at the cross reactors because sometimes you'll see something go, oh, yeah, I do eat that.
Okay.
And it
And that
wasn't
might
tested
explain
on.
then why sometimes I'll have a patient get tests back and they test off the charts for cauliflower. And they say, I literally hate cauliflower. I never eat cauliflower. I haven't looked at cauliflower since my mom tried to make me eat it when I was 3. Like, how's that possible? So it could be a cross reaction with one of the other things on the list.
Could
And
be cross reacting with something that's not even being tested. And that's
right.
always a frustration because
Yeah.
it's like these tests are pretty darn accurate and you can really hang your hat on these results. They are tested in duplicate. They use a purified antigen. It's from that food. But yeah, that's always a concern. This doesn't make sense. And I think you just got to do the best you
You
can
just do the best you can.
when you're interpreting these, or if you're the patient, be aware that if you are continuing to eat those, or say you're avoiding those foods, okay, great. Why do you have that persistent elevation? It could be periodic exposure in certain foods, almost like getting a vaccine booster, where then all of a sudden these IgG antibodies start to go up and they may stay high more long-term. But generally, we see those IgG antibodies being lowered over about a 6-month period. It's about 6 half-lives of IgG. The IgAs and IgMs get cleared quicker. But again, sometimes people do maintain that high Ig antibody response to a food long-term, even if they're not introducing it in their diet.
Now, if someone has their reaction to gluten or another food be brain fog and someone else is knee pain or someone else, whatever their classic non-celiac type symptom, or is it safe to say that when they react to that food, they may also be cross-reacting to a certain body part, meaning eating that food like gluten might be causing them to also flare up against their own tissue?
Yeah, and that's a great question because that's the main reason I think the Cyrex Labs was developed. Is Dr. Vojdani he's really a specialist in autoimmune conditions. He's written a textbook on autoimmunity. In medical school, we get about 1 to 3 hours on autoimmunity. And the incidence of autoimmunity has really exponentially increased in the past 30 years. So again, why are we seeing so much autoimmunity? And I think, again, it's toxic load. Our immune system is being stretched and it's reacting to a lot of these new proteins that it's not familiar with.
So speaking of, go ahead.
No, sorry, you go ahead.
I was going to ask you, you mentioned toxic load. So going back to what you mentioned earlier, you were talking about glyphosate. And I think there's this idea that there's really no issue with gluten. It's really the issue is with glyphosate. That's the problem. So we just need to
just switch to organic.
Right.
Organic
just,
gluten.
As long as you're having organic gluten, you're good.
There's enough podcasters
is that just
out there
hopeful?
putting that out there. That patients
are people just grasping at straws?
Again, not everybody reacts to gluten. And there are people that we get the array 10s on, which is the comprehensive food panel.
Yeah.
I think outside of the normal reference range. And I think a lot of the patients, again, when patients come in to see us and they say, I am totally healthy, I have no GI symptoms, I don't get him. you're not going to be running these tests on those patients. At least I'm generally not.
Yeah.
What we're really doing is we're trying to help these really uncomfortable patients who have multiple symptoms, and they come in to see us. And what can I do to feel better? Because all my tests are normal, but I don't feel good.
Yeah.
And we're like, you're a great patient. I can almost guarantee I can help you, because you're looking at what are they reacting to, whether it's, again, food chemicals or these pathogens. And a lot of times you'll see abnormalities because if they're not, they don't feel well. And it just gives us these clues in terms of what direction to go in. Is it leaky gut, or is it food immune reactivity? And it's amazing. You withdraw these foods that people are reacting to, and most of the time their symptoms fall by the wayside.
Now you're into sports rehab and sports trauma and things like that. And sometimes the sports injuries are not that different than a fender bender or a car accident in terms of, the impact that bodies take on the field when they're playing sports. Is there a link between trauma? Someone's getting along fine in life, relatively healthy. They get into a little fender bender, they have a sports injury. And then all of a sudden, can that be the thing that triggers a gluten intolerance or leaky gut, as far as all of a sudden they're just reacting to all these foods, or a toxin overload? There's lots of sources of toxins, but could it be that someone's getting along pretty well and then something causes leaky gut, and now it's on? Now they're reacting to stuff they shouldn't be reacting to.
Yeah, and that's a great question. Stress is certainly one of the key instigators of gut permeability. So people under acute stress can certainly cause leaky gut.
So emotional stress, not just physical trauma.
Mm-hmm. And then the other thing that's a big cause of leaky gut is anti-inflammatory. So that could be another thought. When it gets injured, one prescription that everybody says, just start taking high dose anti-inflammatories, which I'm not a big fan of because it impairs healing and then is really a culprit for breaking down the gut barrier.
Gastritis and GI bleeds and
yeah.
If you're taking something that can cause your stomach to face all those things.
Renal failure.
That's true. Yeah. And you think about the last 4 years and the stress of what we just went through with COVID. Even if you didn't get COVID, the emotional stress and the emotional trauma of all of that. Oh gosh, I even think mask wearing and not being able to eliminate your carbon dioxide and your toxins was probably not helpful for people's guts also.
Yeah. And then one of you alluded to the autoimmune condition too. But yeah, I think that's another thing, that food, chemicals, and pathogens can trigger autoimmunity, especially when you have leaky gut. So any patient that has family history of autoimmunity or personal history of autoimmunity.
Yeah.
Thyrex has the URA5, which looks at predictive antibodies. And that's a great test just to see if you're forming antibodies against other tissue.
Yeah. And it may not be expressing as a quote named autoimmune disease yet, but you can almost prophylactically avoid certain foods that might be eliciting or contributing to that.
Yeah, because a lot of times it's these cross-reacting to foods, chemicals, or pathogens that trigger that autoimmunity.
And it's such a vicious cycle. I would imagine that, whatever caused the onset of an autoimmune disease, we talked to you about my history of the perfect storm of a lot of things that happened at one time. And then you now develop reactions to certain foods, and then it just becomes this vicious cycle. So now you're eating these foods that you're reacting to, and then that keeps this autoimmune inflammation going. And now you've got this just vicious cycle.
And I think this is what the standard American diet and our high stress lifestyle brings on, I think, for the majority of people. Yeah. And then getting back to glyphosate, I know that was a topic that came up just a little bit ago.
Yeah.
It was first discovered or brought to market by Monsanto in 1974. And they've done tests on humans and saying it's totally fine. Humans and rodent studies, it's not harmful.
Self-funded tests.
carcinogenic or
It is.
totally safe. But what they don't recognize is that it basically it kills off the beneficial bacteria in our gut. And that's something that no one really looks at, but that's how it works. It kills bacteria and viruses, and it knocks out the healthy bacteria.
I've even read that
really
it
detrimental
competes with a particular amino acid. It might even be glycine. It competes for the glycine receptors through the whole body. So if you're eating a lot of glyphosate and the gut lining is dependent on these amino acids, and now that's getting replaced or blocking your normal uptake of these critical infrastructure building block amino acids, then now you have leaky gut. So that might be an association with that. And the thing with the glyphosate is that's what they spray our fields with, right? Or is it something that's inherent in the wheat itself now because it's been genetically modified in some way? Or
yeah, I
probably
do.
all
I
of the
think it's
above.
probably in most wheat products, especially processed wheat. And again, I think it's most toxic to our gut microbiome, which is a delicate ecosystem. So I think that first and foremost, I think our biggest concern, my biggest concern is with that industry. I don't think glyphosate sticks to the wheat and then forms a neoantigen. I don't think that happens, but that does happen with food coloring, food flavoring, and that can stick to proteins and make proteins look foreign to our immune system. And so that could be a basis of autoimmunity.
Okay. And so what's to stop these colorings from sticking to your own body proteins, causing you to attack yourself?
So you want to be avoiding these. You should be eliminated from the diet. And I think you guys probably do a good job I bet you if you looked at your diet, you probably don't have a lot of artificial flavoring.
I don't think it.
No blue yogurt in our house.
No blue yogurt in our house. No red velvet cupcakes.
No, come on.
That's pretty
all
scary.
The processed stuff. And I think the majority of, clinicians that treat people in the functional medicine world probably have a pretty clean diet. You're not eating that stuff.
But it's interesting. I moved down here from Canada it was a while ago. We moved to Maryland in 2021 after we graduated school. And I've always 2001. Oh yeah. Sorry. Try not to be as
time
old as I am. But so I love dill pickle and have only ever bought organic pickles. There's certain brands that I just love that are old world, organic, no funky business kind of pickles. And so in the 20 years I've been in Maryland, I've never gone to a regular grocery store down the regular grocery store aisle to buy a regular jar of pickles. But we were having a grill out and we were out of pickles. So it was just a quick jaunt down the street. This is probably 10 years ago. I don't know when this happened, but every jar of pickles in a regular grocery store turned nuclear, it's like vomit green in terms of the vinegar solutions. And I'm walking down, I'm looking at this neon green jar after jar, and I start picking up the jars, and they've put blue and yellow dye into the pickles. When did that happen?
Yeah. And the big ag could do whatever they want.
And so, this is people get accidental exposures because they're at a friend's house and they just get some sliced pickles on a burger. And if they're not organic, they probably have blue and yellow food dye in them, which are so toxic. And to do what? To make the vinegar look green. Nobody cares.
Read your labels, people.
Most of the fast food is all colored.
It's unbelievable.
The lettuce is colored green, the cheese is colored orange.
Even prenatal vitamins. How many women just get on regular over-the-counter prenatal vitamins? And I've seen innocently commercial prenatal vitamins all have food dye in them, like the actual capsules. Like nobody cares what color the capsules are. Seems very intentional to me, but that's another show.
Yep.
All right. Hey, listen, I do gotta jump off. I do at 1:00, but this was so much fun.
Yeah, we super appreciate
it. I would love to. Anytime you guys want to do this, we can revisit the food stuff. We can talk about anything else.
Yeah. clinically, I know we
This
share
was
a lot
great.
in common. So thank you for your time today and your expertise and your insights and talking about gluten and all the different breakdown glutens that we could be exposed to and cross reactions and all the ways that it can affect us. It was a pleasure talking to you today.
Thanks, Doc.
Yeah, likewise. You guys keep up the good work.
Okay, you too.
All right.
Thank
Take
you so
care.
much.